I am honored to join you virtually for the first family-centered conference in Poland. I am Bev Johnson, President and CEO of the Institute for Patient and Family-Centered Care based in the United States. We are known to many as just IPFCC. First and importantly, I want to say to colleagues in Poland, I bring respect for your country and prayers for peace and freedom in your region of the world. I am part of a global team working with Ronald McDonald House Charities, their chapters and partner hospitals to collaborate in many ways to advance the practice of family-centered care around the world. In our time together, I will define the core concepts of family-centered care and their importance to quality and safety in pediatrics. Showcase how hospitals are welcoming parents as partners in their child's care, and highlight some best practices for partnering with families that are beneficial to physicians, to hospitals, to children and families. Patient and family-centered care is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships. There are four core concepts. The first is respect and dignity for all, for patients and families, for all healthcare professionals, and others who work in healthcare. Second, physicians and other healthcare professionals share information, complete and unbiased information, with parents, patients, and families in ways that they understand and in ways that are useful and affirming. The third core concept is that healthcare professionals encourage and support patients and families in care, in care planning, and decision-making at the level they choose. And as they become more involved in the care and in decision-making, they build their skills for this essential role. The last core concept is collaboration. And it's collaboration not just in clinical care, but it's collaboration in policy and program development, in quality improvement and safety initiatives, in facility design planning, in professional education, and even in research. In our work globally, we use the terms patient and family-centered care and family-centered care interchangeably, but we always promote the active partnerships with patients of all ages and their families. Family-centered care is working with patients and families, not just doing to and for them. Families have an important role in sharing information about their children with physicians and nurses that can lead to safer healthcare and better outcomes in care. Families are essential care partners, not visitors in their children's lives. Families are partners for quality and safety, holders of vital information about their child. They are the constant in their child's life, essential to transitions and continuity of care, and they also are contributors to mental health and well-being for all. Hospital policies, then, should support family presence and participation and not view families just as, quote, visitors. Hospitals can have signs creating welcoming first impressions and provide information that conveys to families that they are partners in their children's care. collaborating with other members of the healthcare team. Family advisors collaborated with physicians and other healthcare leaders to create these positive, empowering, welcoming signs. One example is from a children's hospital in Canada. Another is from the special care nursery at a children's hospital in the United States for their special care nursery. The American Academy of Pediatrics has supported family-centered care and patient and family-centered care as essential to the roles of pediatricians and pediatric specialists. In 2012, IPFCC and the American Academy of Pediatrics collaborated in the development of a policy paper. Recommendations included the following: pediatricians' collaboration with parents is essential to professional practice. Another recommendation stated that pediatrician should unequivocally convey respect for families' unique insights into and understanding of their child's behavior and needs. And another recommendation was that conducting physician rounds in the patient's room with the family present should be standard practice in pediatrics. At this children's hospital at the Medical University of South Carolina, a physician partnered with family advisors to create a tool kept at the bedside to help families participate in their child's care and in care planning and in decision-making. It sends an empowering message to parents that their observations and questions are important. Education for physicians can help them develop skills for facilitating collaborative, family-centered rounds. In 2019, the American Academy of Pediatrics published a very important paper on safety. Many of the strategies to reduce harm in medical care relate to partnering with families in the care of their children and in efforts to improve safety. And lastly, in closing, I want to leave you with an idea for health reform in Poland. Inspiring work has been happening in the large province of Saskatchewan in Canada. Their government, for many years, made an explicit commitment to patient and family-centered care as the standard of care for the entire province. When the new health authority was created several years ago, it reaffirmed this commitment and said, patient and family-centered care is at the heart of everything we do and is the foundation for our values. There may be a strategic opportunity now for Poland to make a similar commitment, an explicit commitment to family-centered care that will inspire change and improvement in all hospitals and in the education of doctors and nurses in your country. Thank you to the Ronald McDonald House Charities chapter in Poland, your partner hospitals, and your many other partners for advancing the practice of family-centered care within healthcare for children and families in Poland.